Hi all, welcome to Facebook Live, another episode. Today, as the season is going about the fever, we will be discussing on the topic fever. Here are with us Dr. K. Vijay Kumar, consultant for internal medicine, to discuss more about the awareness on fever.
Yeah, thank you, Rekha. I am Dr. Vijay. I am a physician working in Citizens Hospital since 10 years. Uh, we see a lot of diabetes cases, hypertension cases, fever, different types of fevers, chronic health diseases, obesity, and non-communicable diseases. Today, we are here to discuss about fever, its causes, its complications, treatment, and precautions.
So, first of all, I would like to ask what is fever and is it harmful for us?
Okay. So when we talk about fever, first we need to know about how our body regulates the temperature inside our body. There is a particular part in the center of the brain called hypothalamus, which regulates the temperature. So whenever we are going out into the cold temperature, our body feels the cold and then tries to raise the temperature from inside. How does it do? It will decrease the blood flow into the skin. It will cause shivering because due to muscle contractions and increases the temperature. Whenever we go into hot environments, our hypothalamus tells our body to sweat a lot, so that sweating will decrease your temperature. So these are constantly going on processes inside the body to regulate the temperature up or down. So when you call fever, by definition, the temperature above core body temperature, all that means inside the body, the core temperature, if it is going above 100.4, then we call it fever. Since it is difficult to measure inside our body, we usually tend to measure the temperature around the forehead, in the inner ear, in the throat, in the oral cavity, or in the axilla. So if you measure from these sites, we call 100, more than 100 degree Fahrenheit as a fever. Is it harmful? Really speaking, it is not harmful. It is a protective mechanism of our body to protect ourselves from the microbial organisms like bacteria, fungus, or viruses. Whenever a microbial organism entering into the body, the signals go to the hypothalamus. That means to kill that bacteria, the hypothalamus tells our body to raise the temperature. That is why the fever occurs.
So, what are the different types of fever?
If you go to classify fevers, we can call it as continuous fevers, which can be throughout the day, continuously present all the time, high temperature, which is usually what we see in viral fevers. Second are intermittent type of fevers, which can be normal in the morning and towards the evening the temperature rises. This is called intermittent fever. For example, in tuberculosis, we see evening rise of temperature. Malarias, we see intermittent fever where alternate days the fever comes up and other day the fever comes down. In typhoids, we see step ladder fever. That means it is going on day by day. It will be going up and up. These are the types of fevers. Depending on the cause, the type of fever occurs.
So, what are the causes of fever?
Yeah, first we need to know what are the causes of fever. First thing is, most common cause for fever is infections. It can be bacterial, viral, or fungal, anything. There are other kinds of fevers where there is no infection, but there is fever. Those are all non-infectious fevers. That can be due to from inside the body or outside the body. If you go by outside the body, heat stroke is classic example where you go out into the sun, the temperature rise, that is heat stroke. If you take some medication which can cause high temperatures, that is the external cause. Internally, without infection, we can have cancers which can cause fevers, that is not an infection. And autoimmune diseases like arthritis can cause fevers from inside the body. And sometimes damage to the brain, where we already discussed the hypothalamus, if it is destroyed or dysfunctional, it will be unable to regulate the body temperature so that it can produce fever.
So, what are the symptoms of fever?
By definition, fever is only the raised temperature, increase in the temperature. But fever as such is a symptom by itself. It is not a disease. Okay. And if you see the fever, along with the rise of temperature, we see other symptoms such as weakness, fatigue, body pains. And if you see the other causes, for if you have common cold, you have no symptoms. If you have motions, diarrhea symptoms, you can have motions, vomitings. If you have malaria, you can have headaches. Depending on the cause of the fever, other symptoms also accompany.
So when should a person with fever consult a doctor or a healthcare professional?
As we discussed already, the fever is a symptom per se. It is not a disease. So usually you can wait for 1 or 2 days with fever. Using home remedies, you can treat yourself at home, like taking good rest, drinking more water, or using paracetamol at home. Once it crosses more than 2 or 3 days, then that is the time where you need to meet. There are exceptions for everything. If you have high fever from the beginning, more than 103, 104, along with other symptoms like headache, vomitings, diarrhea, or any other symptoms, then that is the time where you meet the doctor.
Sir, how is a fever diagnosed?
Diagnosis, there is no diagnosis for fever. Knowing about fever is very simple. Use a thermometer. Like I said, it is difficult to measure the core temperature. Using a simple thermometer, putting it in the mouth for 1 minute and checking the temperature itself tell us what is the fever, how much is the fever. So diagnosis of fever is simple. Using simple home measurement of temperature is enough.
Sir, how is a fever treated?
Treatment of fever, once the patient starts having high temperature, there are some behavioral modification by themselves. They go into under the fan, they drink lot of water, they take out all the clothing, warm clothings. These are all behavioral modifications which are part of treatment only. At home, he needs to take rest because it increases the fatigue. So taking rest is one part of the treatment. Taking plenty of fluids because of dehydration, or to prevent dehydration, you need to take plenty of fluids. Next is paracetamol. If sometimes the patient might need more than paracetamol, like NSAIDs or painkillers or aspirin is also needed to treat the fever.
So what are the precautions to be taken to prevent the frequent fevers?
Yeah. As already discussed, fever is only one symptom. Fever is not a disease by itself. So if you have a cause inside, there will be recurrent fevers. If you treat the cause, like underlying cause, if you treat the cause, definitely we can get rid of the fever. The way to prevent the disease, like if you have common cold, frequent common colds, there can be vaccine can be given for that patients. Exposure to infected persons, using mask like we used in COVID can be a part of prevention. In case of malaria and dengue, cleaning our surfaces and preventing the mosquito bites is one of the prevention techniques. And using proper hand wash, proper cooking methods can prevent from diarrheas, etc.
So what are the complications associated with high fevers?
Yeah. As we discussed, treating fever, is it important or is it necessary? We need to discuss now. Once you say there is high temperature, there is a increase in oxygen consumption of the body. There is an increase in metabolic rate. There is increase in energy consumption. All these things take a toll on our body. That is why we feel a lot of fatigue and weakness. And sometimes all these things, to prevent from dehydration, you need to treat fevers. And in case of children's, if the temperature is high, they have a risk of seizures also. That is where you need to treat the fever.
What are the dietary precautions to be followed when a person is having fever?
Yeah, this is a common misconception or doubt many people have. As soon as the patient comes into the doctor's chamber, after everything, they will ask a question: what can we eat, what should not be eaten? So the first and foremost, as we discussed, dehydration is the primary complication of a fever. So taking plenty of fluids, it can be plenty of water, plenty of ORS, fruit juices, or any homemade fluids needs to be increased to prevent dehydration. Next thing is, as the energy consumption is increased, the systems, all other systems are little malfunctioning. So taking very light food is important. More than food, fluids, I think fluids are more important than importance given to the food. Usually, there are certain diseases like diarrheas where the intestines are already disturbed. So you need to take more of very light and bland kind of foods.
Sir, overall, what is your opinion or conclusion you would like to say on the topic of this fever?
Yeah. So as the fever season going around, like in the monsoon seasons, there are commonly so many patients waiting in the hospitals, or once the one patient in a home or a family gets affected, everybody is getting affected within the family. So knowing about fever is important, and rushing to the hospital on day one, doctors can also can't treat it as well. So you can wait for 1 or 2 days at home with simple home remedies. Most of the viral fevers can subside by themselves. Once there are any warning signs like pain abdomen, diarrhea, cough and cold, breathing difficulty, any other complications associated with fever, then the doctors can help you. So on a whole, when you have a fever, take rest, good amount of rest. Drink plenty of water, ORS, electrol, coconut water, soups, homemade liquids, plenty of liquids you need to take. Good amount of rest, and then take paracetamol as and when needed, like every 6 hours paracetamol also you can take. After that, in spite of taking all these things, more than 2 days or 3 days have passed out, and since still the fever is present, then you can come to your doctor and then get treated. Knowing the cause is important, as most of the seasonal fevers are viral fevers. They are all self-limited, so they usually come down by day 3 or day 4. Once there is some other reason for it, like a bacteria, like a fungus or something else we diagnose, where you take help of the doctor and investigations, and additionally you use some antibiotics or something to get rid of the fever.
Thank you, sir, for discussing on this topic and educating us on this minor fever symptom so that we could know the cause and complications on this topic and when should we come and consult a doctor. Thank you, sir.